recording. Okay, so last week you should have received all your week 3 material, and this week you should have received all your week 4 material this past weekend, right? At least for my students, all exam 1 grades were posted. I sent you guys out the whole list of times over the weekend. There were like 8 slots for each day. Only a few got filled. I think I met with maybe 5 students, 6 students over the weekend. So a lot of time. And I know people work on the weekend. I try to do them late at night. But anyway, so as I said in my announcement, when I said the grades are posted, if you receive below a 78 or 80, I highly encourage you to review the exam going forward. I really do. So that's that. If you are standing right now below a 78, you're considered at risk. And so I have to complete at-risk reports every Monday and send them to your campus deans, because the faculty has at-risk meetings every other week for each campus, and we talk about at-risk students. So if you did score below a 78, know that, and I sent mine out last night, so I worked on them over the weekend. So if your dean reaches out to you, if you got below a 78, know that that's why. Okay, because I have to send them that report. Okay, so that's the guidelines I have to follow. So they may be reaching out to you. I also let them know if you, pardon me, attend review sessions, attend tutoring sessions. So that's all updated. Yes, they attended a review. No, they didn't. Yes, they came to a tutoring for exam review. No, they didn't. So I just don't want you to be surprised if your dean reaches out to you. Study guide 2 will be coming shortly. We're just waiting for all the updates for exam 2 to be put in. Since we revamped the exam 2 exam last term, we have to revamp the study guide. So I'm hoping to get that study guide to you in the next couple of days. It should be ready, hopefully. And as you know, I like to send study guides out at the beginning of the weeks that we're covering that are going to be on the next exam, right? So exam 2 is covering weeks 3, 4, and 5. Right? So today we're covering weeks 3 and 4. So I'd like for you to have the study guide this week so that you can go back and review it for information covered from weeks 3 and 4. Make sense? Okay, for all the people that I'm letting in the last 5 minutes, please put your name in the chat. I need to take attendance for Dr. Lundy. Even if you're my student, put it in there. Put your name in there, because I'll do my attendance after the fact. Okay. I do want to cover a couple of things. Oh, by the way, after I'm starting to look at your case studies that you guys turned in last week and your peer reviews, peer responses, really, really good job. I'm hoping to grade them today and tomorrow. I wanted to get my at-risk reports done, but really, really, really nice job. Really nice job. So from what I've seen so far, they look great. So really nice job. So you guys are 2 for 2, doing great. Professional development plans were awesome. Awesome. My favorite activity to grade. And now reading the next big one, which is the case studies and working in groups. Really, really impressive. So great job. Great job. Okay. Any burning questions that we need to go over? Nothing? Okay. So I'm going to share my screen because I want to go into, we are going to want to review the next group assignment and your vulnerable populations assignment. At least I want to introduce them. I'm reading from my notes because I have a lot to cover today. So at risk we covered. Okay. So let's go into, those are my babies from across the pond. And so we have a new little teeny baby to add to that now. All right, where did I say I'm going? I said I'm going to the module. Right here. Okay, so I'm going to week 7. If anybody's following along with me, I'm going to week 7. Okay, and I'm going to this link, group project discussion, peer review activity. This is, and I know we're only in week 4, but I just want to let you know, I want to introduce you to this. Okay, so in week 7, you're going to be doing your second group project is due. And all the information about that project is in the week 7 module. So you have to go back there. Okay, so what's going to happen is you guys are going to go to this website. You'll go to week 7, go to this website, and you're going to find, it's the list of infectious diseases, right? We're giving you the link to the National Foundation of Infectious Diseases right here. Okay, so I just need your group probably this week to just send me an email of what infectious disease you're going to pick. Okay, there's lots to choose from, and that's what you're going to work on as a group. Okay, and here's your guidelines, infectious disease paper guidelines. So you guys can read through all of this. I just want to introduce you to the topic, or to the what you're going to be doing in week 7. So you still got 3 more weeks to do it, but probably want to pick a topic with your group this week and send it to me. I just need to make sure that not every group is doing the same infectious disease. I like to spread it out so that we all learn. Okay, makes sense? So somebody take the lead in your group and just simply for now, pick out an infectious disease and send it to me. And then you guys will start working on this project. Okay, any questions on that? And the same thing with the infectious disease project. The initial post is due on the Wednesday of week 7, right? And then your 2 peer responses are due on Sunday, just like we just did with our case study. Okay. The next project I want to introduce to you today is due in week 9. So you have to go to week 9 to get the information. Okay, this is a biggie. Okay, this is your vulnerable populations assignment. Okay, it looks like it's due June 12th. Okay, I'm just reading from my screen. This is all in your module. Okay, this is not an assignment that you guys can start in week 8. Okay, I'm just introducing it now so that if you want to get started, you can get started, because it's basically a research project. Okay, and it's submitted as a PowerPoint. Okay, so here I'm just going to read a few sentences from your overview. So you are going to be selecting a vulnerable population in the community you live in. Okay, not overall. I don't want to know all the national stats about homelessness and teen pregnancy. I want to know about a vulnerable population in your community where you live. What's going on in your own community? And it always happens. I always get a few PowerPoints that are talking about generalized vulnerable population. I need something in your community because you have to research it. Okay, so you're going to be selecting a vulnerable population in your community, helpful hints, search within your zip code, right? You're going to do a windshield survey, which is observing the population. Last term I had a student that whoops, where'd that just go? Where's my picture? Oh, that did the homeless population in her community. She actually went down to the homeless population. She met with them. She interviewed some people. So this is meant for you to become more aware of a specific vulnerable population in your community. Okay. So you're going to be doing 10 PowerPoint slide. Uh-oh, I'm echoing. Why am I echoing? Does somebody... Okay, and then here's all the assignment details. Okay, so don't wait till week 8 to do this. I'm letting you know this about week 4. You still have another month to do it, but if you want to get working on it, some of the things we'd like you to do is, contact. It tells you all. Here's some suggestions right here. but up here tells you what we want you to research. You may want to contact the public health department, get some statistics. You may want to talk to actual vulnerable people in your community with the topic that you choose. So anyway, I'm introducing this now. All right. Anybody have any questions? And if you want to send me an idea, hey, Mike, it's not on this list, which is fine. If you want to go outside of this list, that's perfectly fine. This is just some vulnerable populations that are usually in every community for you to pick from. If you want to pick something outside of that, that's fine.
What do you mean with women with no risk to prenatal care? Does that mean that they literally have no problem getting to prenatal care, or what does that mean?
I don't know. What are you referring to, Jasmine?
It's under the populations at risk of sex. I mean, I'm sorry. It's the examples.
Okay, and where are you looking?
So it's right under
women with no risk,
high risk pregnancies, and then women with no risk prenatal
women
care.
with no risk to prenatal care. I would take that as women that have difficulty accessing prenatal care. But I'll clarify that with Dr. Lundy. Yeah, I'll clarify that. I think what we're looking at here, it's just probably not worded, is what happens when you don't have access to prenatal care. That's considered the vulnerable population. So that's just probably worded poorly. Okay. Any questions about this assignment? It's actually, I think it's a great, I always hear from students how much they learned about a particular population in the community that they were interested, a vulnerable population they were interested in learning about, that they didn't know a whole lot about. So, yeah. Okay, so that's that. Any questions about that? For those of you that are coming in late, I need you to put your name in the chat, please. We're in week 4. So this week you're doing your case study for hospice. Is anybody having trouble accessing your hospice case study? How about this? If you are, let Dr. Lundy or myself know, because we have preloaded those into your modules. We did that before the term even started. So I'm already starting to see grades what do you call it, loaded into the grade book. You don't have to submit anything to us. Okay, once you don't know screenshots, once you do your case study, it populates in the grade book. So you don't have to send anything to us. Okay. And then we'll do our week 4. Well, you guys already did your week 3 attestation, because that was due last week during the exam week. So we'll do week 4 today. So what are we looking for today? Where we have a parish-based question. What are the 2 parish-based models, which we'll cover? List the 5 practice models for home health. Okay, so that's what we're going to cover in our attestation. So any questions before we get started? Let's skip ahead to next week just to see what we got going next week. Next week you have a discussion question, right? So you're doing your hospice case study this week, just looking ahead to next week, discussion question, another NCLEX, and that's it for week 5. Okay. Anybody have any questions? Okay, let's go. If you guys want to follow along with me in your book, that's great. I like to highlight things in the chapters that are, of course, as we talked about for the first exam, we don't need to know every chapter start to finish. Okay. I try and pull out the important things that you will need to know for each chapter, the essential knowledge, the important concepts. And again, the way I teach is I have an expectation that there is a reason I take the time to send PowerPoints and case studies to you ahead of time, so that in your preparation for class, you have a chance to review what we're going to be covering. And as I've told you before, your PowerPoint is this chapter outline. Remember we talked about that? If you go through your PowerPoint, it is exactly what this chapter outline is with just additional information. Okay, so we're not throwing all this information from everywhere at you. All in Community, all the dots are connected. Okay, so the chapter outline is your PowerPoint, and your PowerPoint will have additional information in it. And then so if you want to take a look, if you haven't had a chance to look at your PowerPoints and you want to look at your chapter outline for all the chapters we're covering, this is a good summary of your PowerPoint right here. Okay, that's what we'll be covering today. And then, as I've told you guys in the past, here's the expectation. Here's the objectives. Your objectives in the chapter are exactly the same objectives that are on page 2 of your PowerPoint. They're the same objectives, exactly. Okay, so at the end of each chapter, this is what we should be able to do. Okay, you should be able to articulate and explain, or what does it say? You should be able to compare, describe, discuss, define. Okay, so that's, I know I have Dr. Lundy's students and she may do it differently, but this is what I do. So after we review each chapter, you should be able to do these 5. Okay, and this is what we're going to be covering in the chapters. Okay, anybody have any questions? So chapter 22, this is week 3 stuff, but we're going back to rural health and migrant health. What do you guys think? What's the difference? Why is there an entire chapter dedicated to rural and migrant health? What's going on? What's rural health and migrant health?
Vulnerable population.
Absolutely. Why?
There's a lot of reasons, but the barrier between the language and the lack of healthcare prior to coming here, and the location, the rural health location where they are compared to where the clinics would be.
Language barriers, cultural barriers, access to healthcare. What do you think some of the major differences are between rural and urban healthcare? Anyone?
Maybe rural, they might not have like actual certified personnel, and urban might do have license.
Exactly.
Yeah.
So think of a kid. Do you think kids in the rural migrant communities are going to have a pediatrician? Probably not. They're going to be seeing the general practitioner, right? Lack of access to specialists, right? Let's say you're pregnant and having problems. Think you're going to have an risk OB up in your farm community? No, you're going to be going to the nearest regional centers to get care. Lots of differences, lots of challenges in the migrant and rural community. So let's talk about it. Right. So I've already been through these chapters. So I've highlighted what I want to discuss with you. Okay. So if you want to follow along with me and highlight, you're perfectly fine to do that. Okay. A lot of students do that. I'm starting on page 374. All righty. So access, we just talked about, is a real problem in rural areas, right? And lots of farms rely on migrant workers, right? In their harvest seasons, right? And lots of migrant workers they have lots of challenges, right? So here we discuss what are the major issues surrounding the healthcare in rural environments. Okay, and differences between rural and urban. There are lots and lots of differences. Oops, sorry, I used my hand to. Okay. So basically we refer to as maybe farm residency and non-farm residency, right? A farm residency is usually how the rural people describe themselves. Okay. There's no typical rural town. Everything looks different. Populations, they may have maybe a young family rural environment or an elderly rural environment. So it brings with it different challenges. What are some population characteristics and cultural considerations? Okay, typically, I'm just going to read a few things from here. Regional rural communities usually have a large minority population, right? Typically, rural communities have a higher group of residents that are younger than 18 and older than 65. Okay. Usually, rural communities have a higher rate of poverty, sometimes nearing 40%. Right? And then in rural communities, there's issues with unemployment, higher poverty rates, low education levels. And what we know is, and this is important to know, if you're asked who is the most vulnerable population or at highest risk in the rural community, the answer is, there's a few answers: children, minority racial and ethnic groups, single parent families, especially those headed by women. You will need to know that. Okay, so put that on a card. So if you are asked, poverty continues to be a problem in the rural areas, who are the groups at highest risk? There's your answer: children, minority racial and ethnic, single parent, especially those headed by a woman. Okay, also in the rural communities, clients are at risk for being either uninsured or underinsured. That's a fact. Okay, box 22.1 is excellent. It's a characteristics of rural life. So have a look at that. What are some characteristics? I like to point out lack of anonymity, challenges in maintaining confidentiality, right? In rural community, everybody knows everybody. Nothing's really private. You know, your nurse in the schools may be the pediatric nurse. She may be the labor and delivery nurse. She may wear all those hats. Lots of issues with lack of anonymity. Okay. And then this is important. People in rural areas have a poorer perception of their overall health. Okay, why? Why is that? Right? Well, they are definitely less likely to engage in preventative behavior, right? Which increases their exposure to risk. They're more likely to smoke, and they report higher rates of alcohol and obesity, decreased physical activity, decreased seeking preventative health, such as blood pressure, pap smears, breast health exams. Okay. The other thing that's prevalent in the rural community is chronic conditions. Okay, chronic conditions is huge in the rural community. Okay. The other thing too with rural population is they typically want to remain in their homes as long as possible. Okay, so home care is huge in the rural community, huge, because they don't have to travel into the urban areas, and their family members can't get there to the urban areas if they're far away. So they like to be cared for as long as possible in their homes. Okay, what about women's health and maternal and infant health in the rural population? Okay, so we know that overall rural populations have a higher infant and maternal morbidity, right? These areas tend to have a high proportion of racial minorities and fewer specialists, as we talked about, such as pediatricians, obstetricians, gynes, right? Less availability for those at-risk populations. Another big problem in the rural environment is female victims of sexual assault. That's considered definitely a very at-risk group in the rural area. Okay. It's hard for female victims to come forward, right? We talked about the lack of anonymity. Everybody knows everybody. Okay, so most assaults we know, this is in general, are between a woman and somebody she knows, right? Women may be hesitant to report the assault because of the people, all the people she knows, and the whole community knows her and knows the family. Okay, so that's important to know. This is all about the lack of anonymity and why a very high risk group in the rural population, which are female victims of sexual assault, will not come forward. Okay, health of the children. We know that kids in rural environments are less likely to see a pediatrician when they're ill. Okay, they're more likely to simply have a general practitioner as their regular caregiver, right? We know that children who work on the farms and ranches are often exposed to noise, dusts, and the hazards of working with the farm environment. Why do you think children, in addition to that, why do you think children are more at risk in the rural communities? What else is going on? What about education?
Education.
Yeah. What about education? Absolutely. Access to healthcare, access to, consistent housing, food, right? Kids are most at risk in rural communities. And then we know in rural communities, there is a huge issue with mental health. Okay, stress-related conditions, and mental illness are prevalent among the populations. Okay. And as with the female sexual assault victim, mental health issues, clients delay seeking care when they have emotional problems until it's risen to the level of it's an emergency or it's a crisis. Again, it's the whole anonymity. Everybody knows everybody, right? We have domestic violence, alcohol, tobacco, other drug use, right? Very high in rural populations, right? When people are related to one another or know each other well, they're less likely to report these behaviors. After a time, a small, tight-knit community, destructive coping behaviors often come to be accepted as usual occurrences in the family. So really sad, but it's the reality of a rural community. There's also environmental and occupational health problems in the rural community. And this is important to know. The most common health issue related to farm workers is pesticide exposure. That's number one. Okay, there's 8 risks, but we list pesticide as number 1. But heat and sun exposure, also a problem. Hazardous tools and machinery, infectious diseases. Why are we at risk from musculoskeletal injuries? What happened? What's that about?
They're like bending over all day, hurting their backs.
Yeah, lifting, bending. Absolutely. I would put this on a card, put this on a little index card, because if you're asked, what are the most common health issues related to farm workers? There's 8 of them. Why is heat and sun exposure an issue?
You're always working outside.
Absolutely. What about respiratory illness?
Breathing in a bunch of chemicals.
Absolutely. Skin disorders. Why? What's going on there?
You're in the heat all day in the sun.
Yep. Eye injuries, what's that about?
Working in a factory, things flying up.
Absolutely. All right, so if you think about it, these are your occupational environmental health risks. Okay, page 379. Please know these. Okay. Okay, let's get to levels of prevention. P is what? P is what?
Prevention,
Primary,
S is what?
secondary,
secondary, screening,
Thank you. Tertiary is what?
Treatment.
Treatment, testing, treatment. Yep, yep, yep. So let's review this related to public health. Primary, teach workers how to reduce pesticide exposures. Everybody understand why that's primary?
Yes.
Why? Tell me why.
Because we're trying to prevent, we're
Right.
educating.
Exactly. All right, secondary, conduct screening such as urine testing for pesticide exposure. Why is that secondary?
Screening is always secondary.
Yep. And I always like to think of secondary as early identification. I know we say S is in screening, that's great, but for me, I have a much better understanding of it when I think about it as early identification, right? Because if you early identify by, say, screening, you can early intervention, early treat, right? Before it gets out of hand. Tertiary, initiate treatment for symptoms of pesticide exposure such as nausea, vomiting, and skin. Why is that tertiary?
Because it prevents it from turning into something else.
Okay, be more specific.
Well, like an example of rural sickness is you can get tobacco poisoning if you're pulling like stripping tobacco leaves. So you would want
Sure.
to go ahead and take a cold shower after you have it to try to prevent it from getting to the next worst step.
Absolutely, that's an excellent explanation. In addition to what you just said, why is this tertiary?
Because they already have like
Thank
something
you.
going on. You're just trying
They-
to avoid it from getting worse.
Thank you. Thank you. Thank you. Yep. So what everybody said is correct. But tertiary, we have to remember, is they already have to have the issue, the illness, the disease, right? Okay. From the few reviews I've done with students, there were questions that were answered incorrectly about levels of prevention. So again, I want to stress to you, what are the 3 things I stressed to you about really understanding in each chapter? What are they? Levels of prevention box. What's the second?
CUSIN,
CUSIN.
and healthy people, 2020 objectives.
Okay, is that Brendan, Alex, Brendan?
Yes, ma'am.
Okay, I can't see you, but why, for Dr. Lundy students, can you help explain why I harp on the CUSIN box? Because they're competencies, right? We should, that CUSIN box in all your chapters is quality and education for nurses. Those are in chapter 1, we introduced the CUSIN box, which was identifying 6 competencies that were going to be presented all throughout the term in every chapter. So I always like my students to review that box to see what competency we're covering in this chapter. We'll get to it, it's here, so that they can continue to be more educated and knowledgeable about the competencies expected for them to know. Okay, so Healthy People 2020, levels of prevention, and CUSIN box. Okay. The next section is, this is really, I would like for you to know this as well. This is important because if we are the rural nurse, we need to be aware of what barriers to healthcare might be an issue in rural migrant areas. Okay, we've talked about a lot of these. Lack of healthcare providers and services and great distance to obtain services. This is a big one. Lack of transportation. Big one. Unavailable public transportation, lack of phone, unavailable outreach, right? Unpredictable weather or travel conditions, I mean, lots and lots and lots of issues. So you need to be, if you get asked a question that says, what are barriers to healthcare in the rural areas? Select all that apply. And I don't know that you will. I'm just saying you need to have an understanding of what these are. Okay. Language barriers, culturally, are the rural medical providers, are they culturally competent? Do they know about the cultures of the migrant workers who are coming in to work on the farms? Really, really important stuff. Okay. I mean, think about it. What if there's a culture you don't understand, there's a language barrier, and there's no transportation, and somebody's sick in their family? That's a pretty big challenge, is it not? Okay, and here's a little bit about culture. Our attitudes, insight, and knowledge about rural populations are important. Okay, we cannot have a demeaning attitude. We cannot have a lack of knowledge about our populations or any kind of insensitivity about their lifestyle, right? If you do have any of those, it's going to really inhibit your development of a relationship with your clients. Right? And if we appear or come across to be insensitive, or I guess culturally incompetent, right? What is that going to generate? What's the most important thing? What is the first thing that you have to develop with any population? Trust. Yes. And that is really, really important with these rural and migrant populations, because so many of their beliefs and their values and their practices are different. Okay. Here's something interesting, nothing to memorize or take a look at table 22.1. Healthcare needs, risks, and conditions for certain rural populations. Right? So it goes through farmers and ranchers, Native Americans. What are their healthcare needs and what are their health risks? Very interesting. So have a look at that. African Americans, migrant workers, Native Americans, coal miners, really, really interesting to see the variety of the healthcare needs that each of these aggregates or certain parts of the population might have. Okay. And then the rest of this chapter goes into migrant lifestyle, right? We know that migrant farm workers often have an unpredictable and difficult lifestyle. So this chapter covers two things. It covers the rural population, and then it specifically talks about migrants. And then it goes through the housing issues they have. They may be working in poor and unsanitary working and housing conditions, which will make them more susceptible to health problems, right? Here's some other things: lack of knowledge about services, inability to afford care, availability of services. A lot of the issues are the same with the rural population and the migrant population, but there are some differences. Okay. And here we list them out. Transportation, hours of service, mobility and tracking, language barriers. So a lot of them are the same, but there's some different ones. Children of migrant workers, that's a big one. Okay, these kids are very, very at risk. All right, they may appear happy on the outside, but on the inside, they've got lots going on. Okay, they may be exposed to infectious diseases, upper respiratory tract infections, maybe lack of immunizations, lack of vitamins, just lack of care. Okay, maybe exposed to pesticides, injuries. I mean, they're just really, really, really at risk. All right. And I find this interesting too. Sometimes it's really difficult to determine the age of these kids. Right? Kids as young as 12, maybe out there working next to their parents on the farm, supporting the family. Kids as young as 10 may be at home caring for the younger ones. Right here, migrant kids as young as 8 years old may be staying home to care for the younger kids. And then there's a good section on cultural considerations, which we talked about. The nurse-client relationship, how to establish our values, beliefs, and practices. You know, we don't have to have the same values, beliefs, and practices, but we have to be able to respect theirs and be knowledgeable and educated about theirs in order to provide them adequate care. Here's your Cuen Box, everybody, page 386. I like for you to read this because it goes through what the competency is. So in this case, in this chapter, this is the patient-centered care competency. Okay. But when it goes through a client-centered care question, it focuses on the topics we're covering, which is rural and migrant health, and it applies the patient-centered care competency to that. Okay, so this client-centered question, you can read it, but what would you begin? Would you begin by speaking with the parents? Would you speak with them, or who owns the farm? So anyway, these boxes give a really good specific example of the particular competency we're talking about. Okay, does everybody know what I mean when I asked my group, go back to chapter 1, pull up your Cuen box, it identifies the 6 competencies that we're going to be going through. Everybody knows what I'm talking about, right? That's not foreign, right?
Yes, ma'am.
Okay, good. And so that's why I think it's important to pull up this box in every chapter and read through it. It just gives you one more example of rationalizing rural and migrant care. Okay. And then with my group, here's your case study. I send you guys, whether you do it or not, it's just an extra, you know, I send you 2 answer keys to 2 additional students activities in each chapter. If you want to go through them, you know how I feel about case studies, right? Case studies. I think anytime you can do a case study, it's fabulous because it's a real life situation and you have rationales to look at as to why the answers are correct or incorrect, right? So this is the case study in this chapter. You have the answer key. I've sent it to you. And then you should also have your practice application, which we haven't got to yet, but you should also have the answer key to the practice application, which is in every chapter, which is another student learning activity from each chapter, right? Everybody knows what I'm talking about, right? This isn't foreign to any of my students, right? So again, if you choose to do these few student activities in each chapter, that's great. That's great. Nursing care in rural environments. Rural people, including migrants and seasonal farm workers, often develop independent and creative ways to cope with their situation because of the distance, isolation, and sparse resources. So they really become very creative. Has anybody worked in a rural area, migrant area, that could kind of attest to all these things we're talking about?
The pediatric clinic that I worked in was in a rural county, and we saw a lot of delays and yeah, pretty much what you're saying.
Sure. So, sorry. So you can attest to all of this that I'm saying, of the challenges up there.
Oh, yes, ma'am.
I don't say up there, but out there in the rural communities. I mean, it's just a real different way of life. Okay, so box 22.3. What if you're asked about what are some of the characteristics that we might need to have when we're practicing nursing in rural areas? Okay, well, first one is a big one: variety and diversity of clinical experiences. You will have to bring in rural nursing, migrant nursing, your entire toolbox. What do I mean by that? Med surg, pediatrics, OB, GYN, mental health, leadership. Why is that? Why will you have to bring the whole toolbox with you?
Because they might be outdated.
Pardon me?
They may be outdated and they might not have the supplies on hand that you need.
Okay, what else?
A lot of times you don't have all the resources in a local available area when you're in a rural area. So you pretty much have to be a jack of all trades.
That's exactly right. There's an example in this chapter of a nurse that she talks about. She can't go to the grocery store. Well, she can, but everybody knows her because she's either, some people know her as the school nurse, some people know her as the labor and delivery nurse, some people know from the hospital, some people know her as the pediatric nurse that works in the clinics, some people know her as the wound nurse that comes over and changes dressings for their elderly family member. Does that make sense? They may be doing everything. And the story she tells is going to the grocery store and all these people know her, but they know her from different sets of circumstances in the community. That's what rural health nursing is, right? You certainly have a broader and expanding scope of practice, right? You're caring for all across the lifespan, right? From infants all the way up to the elderly. Well, you're doing it in the urban area too, but it's much more targeted in the rural and migrant communities, right? Flexibility, creativity in delivering care. If you're the jack of all trades in your rural community, you need to be mindful of who needs what when. Sparse resources, professional and personal isolation. Why would that be an issue?
Small community, you can't go to the grocery store without everyone knowing you, so you just stay at home.
Well, yes, that, but also you don't have coworkers you're working with in the hospital or the office. You may be it, right? So the closest you have to getting a second opinion or advice may be a phone call to a bigger community that has other resources, right? And again, here we are with the lack of anonymity. Okay, so just have a look at this. What if we're a rural nurse? Here's all the things that, I mean, you're going to be here viewed as a professional role model. You're going to be the go-to for everything, right? Everything. But what an opportunity. You know, to the nurses that I've talked to that have worked in the rural communities or do work in the rural communities, the opportunity, excuse me, the opportunity for community involvement in informal health education is very, very rewarding. You're it. You're the top dog in that community. Okay. Here's a couple of resources. Again, for you. Okay, Healthy People 2020. Okay, we're in the topic of rural migrant health. So obviously their goals and objectives are going to be related to rural migrant health. So if you get asked a question on an exam in general about Healthy People 2020, I'm going to cover it again. What the only correct answers, let's say it's for this chapter, are in this box. There's only 4 correct answers. Okay, on the last exam, there were a couple of Healthy People 2020 questions that all the answers were good answers, all of them. Right? I think it was the parenting one. How do we communicate with new parents? What's important to communicate? Let's see, one was nutrition, all 4 answers were correct, but only one was Healthy People 2020. Make sense? So when you get asked a Healthy People 2020, please remember going forward, it's asking you just about healthy people. So if you get asked, what is one Healthy People 2020 objective that pertains to rural and urban areas? Okay. Oh, and they're asking for one answer. It's only going to be one of these 4. It's not going to be something that you think should be or I think should be. It's specific to Healthy People 2020. If you get asked a question about this and it says select all that apply, all these 4 apply. Okay, so already seeing people on exam 1 get tripped up on the Healthy People 2020 questions. I can't stress enough. It's specific to Healthy People 2020. All answers may be great, but it's asking about Healthy People 2020. Okay. So here's their goals and objectives. I would suggest you go through each chapter and write the Healthy People 2020 goals down on a card or someplace where you can just review them. Okay. What else do we want to cover? Okay, that's it for that. That's it for that chapter. Any questions? Do you guys have a better understanding of rural and community migrant health? Yes, no, maybe so.
Yes,
I think
ma'am.
so.
Yeah.
Yes.
Really, I mean, some of us may never have any dealing with rural or migrant health. But if you do, this is important information to know. It's a whole different way of life. Last year I needed to get a COVID test because I was traveling out of the country to go see the kids over in Europe. And Tom and I have a lake house way up in Wisconsin, northern Wisconsin, way up there. Rural. That's why I like teaching about this, because I've actually experienced it. I'm not a rural nurse up there, but I'm living in the community. Pardon me, part of the year. I couldn't find a COVID test for miles. The local county, the local little health departments are little like 1-room buildings. Nobody did. Anyway, I ended up driving way far away just to get a COVID test, right? Because the little county public health departments, I mean, half of them weren't even answering the phones. I mean, the access to a COVID test for me was mind-boggling. That's just one little example. Right? And where we are, if one of us gets sick, the closest regional hospital is 45 minutes away. So anyway, okay, let's go into chapter 23. So these are 4 very vulnerable populations that I want to talk about, that we're going to talk about. Okay. People in poverty, homelessness, teen pregnancy, and mental illness. Why? Why do we pick out these 4?
A part of the vulnerable population.
These are really vulnerable populations. Really. Okay. You're gonna have this in every one of your communities you live in. Every single one. Wherever you guys live. This is all going on in your community with these 4. And these are usually the ones that people select for their vulnerable populations assignment. Okay, so again, tell me what our chapter outline is. What is it? It's your PowerPoint that you've all been sent. Okay, it's a summary, right? Your PowerPoint, pardon me, is an extended version of this chapter outline. Okay. And our objectives, here's what we need to know after this chapter. So when we're done today, in the next couple of days or whenever, go back to all your objectives in the chapters we're covering today. Can you explain this? Can you describe it? Can you discuss it? I'm just using these words here. Can you develop it? Can you articulate it? No, we should be able to know these objectives by reviewing the chapter. If I didn't review any of these, you should go back and do your research. I try and be mindful, but I can't cover everything. I'm trying to cover what I think is most important. Okay. So if you don't feel like I covered any of these 7 adequately, go back and do your research. It's right in the chapter. Make sense? I'm trying to be real specific for you guys. I don't need, there was a couple of students who told me that for exam 1, they went back and read every chapter from the beginning to the end. You guys can't do that. It's too much information. Okay, that's why I'm going through this with highlights of what we need to know. And the objectives are a wonderful place to start. All right. Pardon me, I'm just getting over a cold, so excuse me, I apologize. Okay, 4 groups of people who represent members of a vulnerable population: poor, homeless, pregnant teens, those who are mentally ill. Okay, what do we think about these people? What are our attitudes, beliefs, the media? Cultural attitudes are the beliefs and perspectives of that a society values. When you guys drive down the street and see a homeless encampment, what do you think? I mean, I'm not asking you to answer. I'm just saying we need to think about our own cultural attitudes towards.
Sorry, could you say that again? Sorry, I couldn't hear what you said.
What is that? Why is that talking back to me? That's weird. Why did that happen, you guys? Why did that happen?
Your phone.
No, it's my watch. Why was my watch
Oh.
talking? Why is my
Maybe
watch
you
talking
hit
to
it.
me? I haven't done anything. Okay, that actually scared me. I'm 60 years old. I'm not tech savvy. So when that kind of stuff happens, it's like, whoa, Alex, knock it off. I can see you laughing. So there's still people coming in, believe it or not, students. So the students that are still coming in, put your name in the chat, because Dr. Lundy's students, I have to get her her attendance. Okay, so when you think about these 4 populations, you got to check your own beliefs and values, right? And this is a good check your practice. I went through this last night when I was preparing. This is a good box to go through. I want everybody to read through this. Check your own practice. Nurses can examine their beliefs, values, and knowledge about these vulnerable groups by considering the following clinical situations. Right? When you're doing a health screening at a homeless shelter, one of the clients says, do you have some money for a bus fare? What do you do? Right? When you visit a home of an older adult whose kitchen is full of roaches, what do you do? Right? When you make a home visit to an especially unclean home, what do you do if the client offers you food? Right? School nursing. I'm going off script here, but another one, school nursing. What if you're working in a high school and a girl comes in and asks you, where can I go get an abortion? What do you do? So, again, you don't have to agree and have the same beliefs and same values, but you have to be culturally competent and understanding other vulnerable populations, right? Right. So nurses' behaviors in these situations influence their relationships with the client, right? It's important for nurses to value individuals, promote health, respect, and restore human dignity, and try and help improve the quality of life of your clients, right? When you have conflicts in values, beliefs, and perceptions, right, that's going to create problems, right? All different cultures have different social issues, cultural issues, economic. I mean, there's so many issues with the diverse population, and it's getting more diverse. So we have to be mindful of, especially, I mean, sometimes it's hard enough to connect with people that aren't part of these vulnerable populations the we're discussing. Think about how hard it is to connect with these particular populations. Okay, and then it goes through each of the 4. Okay, so we'll just briefly talk about each of the 4. Okay, what have we said? This was on exam 1. What is the greatest indicator for health?
Nutrition.
Poverty. I probably didn't say that right. What is the greatest risk factor for how an individual or a family functions? It's poverty, right? If you are in poverty, if you're a family in poverty, everything's affected, right? You're extremely vulnerable. If you have kids, they're even more vulnerable. You're vulnerable with regards to housing, food security, health insurance, education. It affects every part of your life, right? Anybody disagree with that? Causes of poverty are complex and interrelated, right? The following factors affect the growing number of poor persons in the United States. Here's a list, a beginning list. Okay. What's happened over the last 2 years? Why have so many additional families? I mean, I see it in the schools. Oh my gosh, the number of homeless families in schools, elementary school level, in the last 2 years has just shot up dramatically. Why?
COVID-19.
Yeah, and what happened with it? What happened?
People lost their jobs because they had to stay home with their children.
Yep. Excellent. Yeah. Yeah. So here's some other reasons, but I like to bring up the more common reasons or more recent. I mean, COVID has had a devastating effect on families, has moved many people from the above the poverty level into the poverty group, which is just had a snowball effect. Okay. And I bring up mental health as well. Okay. The lack of socialization, the lack of isolation, right? What are poverty and health? What are some effects across the entire lifespan? All right, poverty. There's a reason why poverty is selected as one of the 4 most vulnerable populations. It affects everything about your family, right? Higher rates of chronic illness. I need you to know this. Okay. If you're asked a question about how does poverty affect families across the lifespan? How does it affect them? Are there higher
Lack of
rates?
access to healthcare, so they don't get proper treatment.
Yep, absolutely. And I'm looking at the book here on page 394. Are there higher rates of chronic illness? Yes. Is there higher infant morbidity and mortality? Yes. Is there a shorter life expectancy? Yes. So there are more complex health problems? Yes. Are there higher hospitalization rates for those great families in poverty of higher hospitalization rates? Okay. Next box, huge, huge, huge. Got to know this. Box 23.1. What are the effects of poverty on the health of children? Huge. Okay, the children are most impacted. And here's a list. Nutritional deficits, injuries, accidents, risk of homelessness, decreased opportunities for education. So please know box 23.1, really important, because when we're talking about poverty, kids are most affected. We need to know this information. Okay. Homelessness. Okay. How do you evaluate the concept of homelessness? Let's think about it. What do you think it's like to live in a, maybe some of you have been homeless in the past. Who knows? What is it like to live on the streets? What issues might you confront? What happens when you confront a young mother with her kids inside a homeless shelter? We think, how is it that people are so poor they have no place to go? Well, they are. Right? How do you, again, respond to somebody on the street asking you for money to buy a sandwich or catch a bus? What if it's a mother with young kids? How do you react to the smell of urine in a stairwell? Again, it goes back to our values, beliefs, our compassion, our understanding, our education. Okay, so we're talking about homeless population now. Here's a case. Here's your case. Here's your case example, guys, that I've sent you the answers to. If you want to go through your student activity here, there's your case study right there. I've already provided you the answers to it. You don't have to go to Evolve and find them. Okay, I've already given it to you. We use this all the time in schools, right? It's called the McKinney. We called it the McKinney Act. Okay. And how do we define, because in our district, we have a huge district, 80,000 plus students. We had an entire homeless division in our district, right? And we're always talking about, do they qualify for the McKinney Act? Okay, that was always part of our discussion. And you don't need to know this, but I'm just telling you, this is how at least families in our school system were qualified for homelessness. Okay. Where was their primary residence? You guys, a lot of this I saw in week 3's. You guys went back here and pulled this out for your week 3 attestation question. Okay. Effects of homelessness on health. I mean, that's pretty obvious. Homelessness is correlated with poor outcomes, right? Homeless people often have the following health problems. Again, another good list to know. You know, if you're asked a question, what are homeless people typically more at risk for? Well, hypothermia, poor skin integrity, diabetes, TB. Why? Why are they higher at risk for TB?
They sleep in shelters or in homeless camps, and they're all close together.
Exactly. Mental illness. Why are they more at risk for mental illness? Just with the current situation. And what if there are kids involved? What if they're elderly involved? What if it's a family unit? Very stressful. And then obviously, as we've all seen, the increased use of tobacco, alcohol, drugs, right? Healthy People 2020 is on page 398 in this chapter, and the objectives are related to the poor and homeless people, adolescent reproductive health, and mental illness. So there's 6 objectives here. Okay. And these are all related to these vulnerable populations. So please know this. If you get asked a question about what are some objectives related to healthy people's homeless people, the right answer is only in here, these 6. Anything beyond these 6, it may be an excellent idea, but it's not Healthy People 2020. Okay. And then this, I'm not going to read, but I want you to read this. It is on page 398. Everything I've highlighted under homelessness and at-risk populations. Okay. This is an excellent summary of the health problems with regards to the homeless. Specifically down here, it talks about children. So I really would like for you to have a read of those 2 paragraphs on page 398. Okay. It starts with being homeless affects health across the lifespan. And then it goes through and talks about that. Okay. We know that homeless adolescents living on the streets exhibit greater risk-taking behaviors, including early onset of sexual activity, which hence is why one of our big vulnerable populations is what? Teen pregnancy. Right? Quenisha, you said you were right behind me, right?
Yes, I was highlighting, so I had to take myself off.
No, that's okay. All right. And then homelessness, they talk about can be short-lived or long-term. People may find themselves, a lot of COVID, families found themselves homeless because of temporary loss of job. Other families, it's a chronic problem. They remain homeless for generation after generation. Okay. You may become homeless. I'm just reading here because as a result of a catastrophic event. All right. And then get back on your feet. But there's a lot of people who don't get back on their feet. Okay. Here's our trends in adolescent sexual behavior and pregnancy. This is all about your teen pregnant, vulnerable group, right? And we know that teen pregnancy is a public health concern because of its significant effect on the communities. How does teen pregnancy, how does it affect the community? I'm asking you guys. What effects does teen pregnancy have on your community?
Well, it can be a burden on the society financially. It can
Require, go ahead, Sarah.
I was thinking of the case of that high school where they had the pact where all those girls
Yeah.
got pregnant.
Yeah. Yeah. Well, think about it. Lack of education, increased need for resources, potentially talking about low birth weight babies, which present their own set of issues for, and I don't say burden in a negative way. What we should say is of how many additional resources they're going to need. Whether it's, teen mental health, where's the father in this? Is he also a teen? Lack of education, lack of maturity, lack of, it's just, I'm not saying it's negative. I'm just saying that teen pregnancy has significant impacts on your community. Okay. And then you can read through this if you would like to. Another factor that I highlighted in here is that these teens who are pregnant are more likely to have been sexually abused during their short lifetime. Right? They say it's as high as 60 to 70% of them have been sexually abused. Right? Adolescent girls with a history of sexual abuse are at risk for earlier initiation of sex, right? They're less likely to use birth control, more likely to use illicit drugs, alcohol. Very big problem. And then it goes talking about young men and paternity. Really challenging issues here. But if you're working in the community, public health community, you're going to be faced with these issues. Teen pregnancy is a really challenging, vulnerable group. And then it goes to early identification. And here's, as community nurses, do we know the availability of affordable abortion services? Right? Nurse should be knowledgeable about abortion services, provide information, or be able to refer a pregnant teenager to a pregnancy counseling service. Right? And on the flip side, the pregnant teenager needs information about adoption. Right? They're typically lost. They don't know where to turn. Right? Church organizations, private attorneys, social service agencies. Right? We should know, as a community nurse, we should know all those resources. Right? And then we also know that pregnant teens are considered high risk OB. Okay. So every pregnant person is not considered high risk. Okay. But pregnant teenagers are considered high risk. Potential age, lack of knowledge, inability to follow up with appointments, lack of prenatal care, many, many reasons. Okay. And then it talks about violence, that these teens are typically more exposed to violence during their pregnancies. Very sad. Okay. Right. So violence in pregnancy has been associated with an increased risk for substance abuse, poor compliance with prenatal care, and hence poor birth outcome. Okay. So you can read through that. Right. And we as nurses should be able to look for signs of abuse. Right. As well as a controlling, intrusive behavior from a partner. Tough stuff. But if you're out there in the community, this is potentially what you might be facing. Or if you're working in a community pregnancy clinic, Okay. And then it talks a little bit about nutrition, how important it is for the pregnant teenager. Okay, this is important. This how-to box on page 404. How do we as nurses promote interactions between teen mother and baby? How would you talk to a teen mother? Okay. What are some of the important things you're going to look for? Right? The number one is bonding. Right? You are going to look for adequate bonding activity. Do they hold their baby close to their face? Do they meet the needs of the baby? If the baby's crying, do they pick the baby up? The baby's hungry, do they feed the baby? If the baby needs a diaper change, or did they try and figure out why the baby's crying? So being a mom of 4, working in the schools forever, my little poor new Patrick, who was born Wednesday afternoon, I went up to the hospital Wednesday night, and the kids just handed me Patrick, and Patrick started crying. He was crying for like an hour, and I'm like, what does Patrick need? I have no clue. No clue. But he just cried and cried and cried and cried, changed his diaper, did this. But, you know, I tried everything to meet his needs. That's what we're looking for with new mothers, right? They're trying to meet the needs. Okay. Are they talking to them? Do they sing to them? So just have a look at this. This is all feel-good stuff. This is all feel-good stuff that we should be observing, right? And we'll get into it when we talk about the faith community nurse in a little bit here. This is what they look for. This is what they want to observe. A lot of faith community nurses are tasked with going out in the community, in their congregation, to meet with new families. This is what they want to look for. Okay. So if you get asked a question about what would be concerning to you if you went to visit a new mother, or what behaviors do you want to see the parents exhibiting, or what's of concern to you? This is a good starter. Okay. So please be familiar with that. And then it goes through mental illness. Okay. And I need you to basically know that mental illness is one of the high at-risk populations. Who are the at-risk populations for mental illness? Certainly children and adolescents are. Adults, and it goes through each kind of across the lifespan. Adults with serious mental illnesses. Actually, I take that back, way back up when we talked about this is the actual case study that I provided you the answers to. It's not the first one. Okay, this is your case study, page 408. So in your announcement, when I send, what is it called? Student-led activities in the chapter, case studies, this is what we're referring to. So have a look at that. That's a good one. That's a really, really good one. Okay. Older adults, what does mental illness look like in the older adults? This is excellent. I actually use this. I use this for the last couple of years in the schools. Here's some information. People with mental illness, mental health problems. Look at this list. It's awesome. You got your AA, your Al-Anon, your Alzheimer's, anxiety disorders. This is an excellent list for you to print out and keep handy put it in your toolbox for your resources. For whether it's family, friends. I use that all the time. Okay, levels of prevention. We need to understand how levels of prevention related to poverty, homelessness, teen pregnancy, and mental illness. Okay, so here, page 410 is our levels of prevention. And in this chapter, it's related to community mental health. So they're picking one of the 4 vulnerable populations, and we're doing it. Okay, so let's look at, it tells you right here, primary, prevent, secondary, says limit disability. So just substitute that for kind of like early identification. We're trying to limit what's going on. We're trying to identify who's at risk early on so we can kind of stop the runaway train, right? Limit the disability. And then tertiary, they already have the disability. So we're trying to reduce it. Okay, so classic, educate populations about the issues, teach stress reduction, support and provide prenatal education. All this is preventative. Secondary, conduct screenings to identify mental health disorders. That's that early identification, right? Provide mental health interventions after stressful events. Okay, they may not have a full-blown mental health diagnosis, but they may have had an extremely stressful event. So we want to help them deal with that stressful event before it goes into a mental health diagnosis. Make sense? And then tertiary, okay, now they have a mental health issue, right? Provide health promotion activities to somebody with persistent or serious mental illness. Have a support group with people who have mental health disabilities. Advocate for rehab and recovery services. This is an excellent, clear-cut box of prevention levels. I know it's focused on community mental health, but it's a really good generic list. Does that make sense? Okay, people are still coming in, so put your name in the chat box. Okay, and here's your QSIN. Okay. Not going to go through that. Okay, I didn't realize it was already 2:22, so let's keep going. Okay, next chapter is alcohol, tobacco, and other drug problems in the community. Okay, here's your outline, which is your PowerPoint. Okay, here's what we should be able to do. Here's what we should be able to do after going through this chapter. Okay, so let's get in here. Okay, we know that substance abuse is the leading national health problem, right? Causes more deaths, illnesses, and disabilities than any other health condition, right? Considerable death and disability are caused by the use of alcohol, tobacco, and illicit drugs. Think of that, what we hear in the news all the time. What are we hearing on the news? I mean, we have the highest number of overdoses ever, right? What was it, over 100,000? What did we just hear? The numbers are staggering, right? We know that substance abuse affects, addiction affects all ages, races, sex, segments of society. Okay. Scope of the problem, right? I'm not going to kind of skip through this chapter pretty quickly because you guys can go through it, but it goes through the different kinds of drugs. Okay, what is the scope of the problem, right? Important about educating about dangers of smoking and alcohol, yes. Okay, so it goes through some definitions. What's substance abuse? What's dependence? What's withdrawal? What's drug addiction? Okay, then what are psychoactive drugs? What are those? Okay, you can read through that. Read through the header is psychoactive drugs. So then they talk about what are depressants? What are stimulants? Okay, alcohol, tobacco, caffeine, believe it or not, caffeine is listed here. Caffeine is one of the most widely used psychoactive drugs in the world. All right. Talks about doses of caffeine and how they have an effect. And then we talk about illicit drug use. Okay. I don't need you to know everything. I just need you to know what they are. What are we talking about with illicit drug use? We're talking about opioids. We're talking about, these are all in separate headings: opioids, cocaine, amphetamines, methamphetamines. Okay, so I just need you to know the categories. Okay. Marijuana, big. Okay, what do you know about cannabis use? Okay, street drugs. Okay. Okay, so there's all the different kinds of illicit drugs. I think there's 5 of them. Okay, so just know what they are. All right. What are some predisposing contributing factors? Right? The set and the setting. Okay, know those two. Know what a set and a setting is. The set is the person using the drug. Okay. And the setting is the influence. Okay. Pretty easy. Okay. Genetic factors in addiction. Interesting, very interesting, right? Primary prevention and the role of the nurse. Okay, what is our primary role? Our primary role is harm reduction. All right, what is harm reduction? Just exactly what it says. We're trying to focus on health promotion and disease prevention. Okay, and then it gives a couple of primary prevention activities for ATOD is alcohol, tobacco, other drug. Okay, alcohol, tobacco, other drug. When it says ATOD in this chapter, that's what it's referring to. Okay, so I'd like for you to know these. What are the two primary prevention activities for alcohol, tobacco, and other drug problems? Promotion of healthy lifestyles and resiliency factors. That's number one. Right? And education about drugs and guidelines for their use. We as nurses can be hugely impactful. You know, I felt hugely impactful when I was working with high schoolers and teaching them of the effects of illicit drugs, right? We can be very effective teaching, promoting, and facilitating people to choose other options, healthy options, rather than the reliance of drugs. We have a great impact. I felt like I had a very big impact on the middle school kids and the high school kids. Okay. We can teach them how to be assertive in relationships, how to say no. Okay. And then I want you to go through your levels of prevention, page 424. I want to get to chapters 29 and 30. Okay. So please review that. If you don't understand it, let me know. Okay. This also doesn't have a primary, does it? Yeah, but this goes through, if you want to get a really good understanding of primary, secondary, and tertiary, this is the best description in the whole book. It expands on the box. So primary starts on page 423. It talks about all, and I know we're talking about alcohol, tobacco, and other drugs, but this is an excellent summary for an understanding of primary, secondary, tertiary in the general sense. So primary starts on 423. Secondary, okay, starts on page 425. And it goes through activities in each of these levels. Okay, talks about drug testing, drug screening. Here's your Healthy People 2020. So we're still in secondary, but Healthy People 2020 is here. There's only 3 objectives related to substance abuse. We're still in secondary, so we're covering all the groups across the lifespan: older adults, injection, drug use during pregnancy, right? And then we get to our tertiary. So if you read through all of those sections, it's telling you what's in each one. Okay, I know it's long, but it's a really good breakdown of what's included in each level. Okay, codependency and family involvement is included in the secondary level. Tertiary, right? They already have the issues. So what are we doing? We're detoxing. We're getting treatment. We're smoking cessation programs, support groups. And then lastly, what's our role? This is an excellent, it's hard reading, but it's an excellent chapter for breaking down primary, secondary, and tertiary. It really is. And I know what they have in each category is based on alcohol, tobacco, and other drugs, but it gives you an understanding of what kinds of activities and roles and interventions are found within each level at a much more detailed, in a much more detailed way. Okay, make sense? Okay. Here's your practice application that I've sent you the answers to. This is actually a really good one as well, page 430. So you go through this, read the scenario, answer the questions, and then go to the answer sheet I gave you. Okay, you've got A, B, C, D, and E. Excellent, excellent, excellent. Don't have to go to Evolve website right here. I already sent you the answers. Okay. All right, let's go to chapter 29. Okay. So helpful information, all of this, do you guys have a better understanding of rural, migrant, particular populations that are very vulnerable, and then your alcohol, tobacco? Tough subjects, but you know, if you're working in community nursing, this is what you're going to be doing, right? Or part of what you're going to be doing. Okay, I'm going to chapter 29. Okay, let's talk about what's a faith community nurse? Anybody know any faith community nurses or know what they do? What is it?
My aunt is a parish nurse.
Ah, there you go. What does she do?
So for her church, she gives all of she's like a local resource for her congregation to come and talk to her, and she gives flu shots and she gives advice. She's just easily accessible.
Yeah. She probably does home visits. She does, yeah. Parish nurses are awesome. Okay. So here's your outline, which is your PowerPoint. Okay, let's talk about parish nursing. Okay, there are parish nursing, nurses often confuse religious practice or religiosity with spirituality, right? And they may neglect the patient's needs. So first thing we need to understand is the difference between religiosity and spirituality. Okay, so religiosity relates to my specific religious beliefs, your specific religious beliefs. And remember, when we're talking about this chapter, it is any denomination, Protestant, Lutheran, Catholic, Muslim, doesn't matter. And for purposes of this chapter, the congregation could be a church. It could be a mosque. It's whatever's in your life. Okay. So it's opened up to anything we believe in. Okay. So religiosity is what we believe in. Okay. So for me, I'll use me as an example. I'm Catholic, so I go to church. Okay. Somebody else may be Muslim and go to a mosque. Okay. But my religion is Catholic. Somebody else's religion may be Episcopal. Somebody else may be Baptist. Okay. Spirituality then is the big picture. An individual's attitudes and beliefs related to, here it's kind of wordy, but the transcendence or to the non-material forces of life and nature. So how do you think of spirituality? Does that make sense? You have to be able to decide between the two of them. The other thing that we need to know is definitions. Okay. Well, we need to know faith communities, parish nursing, faith nursing, it's all one and the same. Okay. Who works there?
It's my aunt.
Yeah. So Sarah's aunt is considered a parish nurse, but we could also consider Sarah's aunt as a faith community nurse. Okay. All those go interchangeable, but for purposes of this chapter, we're talking about parish nursing. So parish just doesn't mean going into a Catholic church and being a parish nurse. It's any institution. Okay. What is a health ministry? Health ministries are those activities and programs in faith communities that are organized around health and healing. So that's what Sarah's aunt does. Here's a list of what she might do. She may go visit in the home. She may provide meals for families. I'm right here on page 511. She may participate in quilting circles. She may hold support groups. She may have healing. It's whatever the congregation wants. Parish nurse is usually under the direction of the parish leaders, right? They determine what they want you to do. Okay. And that's what she does. So we need to know box 29.1. You may be given a scenario and asked, is this the congregation-based model or institution-based model? Simple way to remember this. There's two models of parish nursing. One's congregation-based, which is you're only dealing with the congregation, whatever that congregation is. Okay, you're responsible to the congregation and the health ministries that you want they want done within that community. All right, so here it is. You're responsible for the congregation, its governing body. Institutional based, on the other hand, it includes collaborations and partnerships. So let's say the health ministry wants to be able to care for the elderly in the home that might need PT or OT or meal prep services or wound care. Okay, well, let's assume that the parish has said, we just want you to be doing home visits and we are going to partner with the community for other relationships, physical therapy, home health, because this is the limited role we want you as the parish nurse to play. But we do want to serve our clients in the community with many other services. So we have to partner out. So it's institution based, meaning there's collaboration and partnerships within the community. So we may be contracting with hospitals, medical centers, long-term care, educational, for teaching or workshops, whatever. Does that make sense? So congregation is only within the congregation. Institution, we start to branch out and build partnerships in the community. Okay. You can read through the historical perspectives, but there's only a few things I want you to pull out of this chapter. Okay. If you want to read through the history, it's great. It's actually pretty cool. Characteristics of faith community, right? So your goal as a faith community nurse is to develop and sustain health ministries within the faith communities. Again, you're working as part of the team with the leaders of your congregation and decide what services they want to provide, right? The biggest difference between a parish nurse and, say, a home health nurse is the spiritual dimension. That's why you're called a faith-based nurse, right? The spiritual dimension is central to the practice of parish nursing. Right. And so parish nursing involves physical, it's right here on page 514, physical, psychological, social, and spiritual dimensions. That's the key difference. Okay. Levels of prevention. Okay. I'm going to have you read. This is an excellent box. It gives numerous examples for each one. I want you to read through this on your own, page 516. If you don't understand it, you need to get with me. Okay, this is excellent. This is one of the better boxes in the whole book, just because it gives so many examples of each. Okay. And then this is important. A lot of what parish nursing does is working with maternal and infant health. Okay, so if that parish nurse, if one of the tasks that they have decided they want this parish nurse to do is to visit families immediately after birth of a new infant to assess parenting skills. We just talked about this back in the teen pregnancy section, but think about this, that they're visiting all new parents. Okay, what do they want to look for? When they do their first visit, what are they assessing for? Right here, infant bonding. Reinforcing holistic reflection of life transitions. Remember, the spiritual part is going in here. The plan for the faith community support. How can the faith community support these new parents? They don't have to be teen parents. It could be any parents. But interestingly, what are they going to be looking for? Assessing parenting skills and infant bonding. Right? What else? There's two other bullets that they're going to be doing as well. Right? Maybe doing support groups to reinforce positive health during pregnancy. So this is prior to pregnancy. Maybe doing prenatal classes. So I need you to look at this box as well, because faith community nurses play a very, very important role in maternal and infant health in general across the board. I know every congregation has their own, wish list of what they want the faith community nurse to do, but this is pretty standard. Maternal and infant health, very involved. Okay. And then what are some issues that will come up in faith community nursing? Well, just like, you know, so we're going to talk about, well, we've already talked about school nursing, occupational nursing, faith-based nursing, home health, hospice. All these professional issues are going to come up in each of those different types of nursing. So we're just introducing it now. Okay, so in faith community, here's what professional issues may look like. Okay, so write this down. With all these specific nursing roles, we're going to have professional issues. Okay? We're going to have ethical issues. We're going to have financial issues. They're just all going to come up in these different areas of nursing. So be prepared to review that in each of these chapters that specifically cover a particular community nurse. Like I said, we've already done the school nurse. Now we're doing faith nurse today. Next chapter, we'll do home health and hospice nurse, and then the occupational nurse. Professional issues are going to come up in all of them. Okay, here's your ethical issues. Okay, and we have a whole other chapter on ethics. Legal issues, that's going to come up. And financial. Okay, so those are the issues that are going to come up with all these practices. Faith community, home health, hospice, school. Okay, so just have a look, just briefly read through these sections and just educate yourself on what's an ethical issue, what's a legal issue, what's a financial issue, you know, what could be a professional issue. Okay, because they all have different ones. Then your Healthy People 2020, okay, page 519, have a look at that. It's related to faith communities. It's excellent. Okay, this case study is really good. If you want to go and review that, I've already given you the answers to it. Excellent one. And then you can go and look what the functions of the faith community nurses. Look at all the things that we might do. We might be an integrator of faith and health. We might be a personal health counselor. We might be a health educator, referral agent, advocate, coordinator, you know, developing health fairs, support group leaders, right? It's awesome. I want to be a parish nurse. It's awesome. The impact that you guys can have in the community. Okay. And there's your Cuen Box. Okay. The targeted competency here is quality improvement. Right. And then your quality improvement question, it goes through a scenario, asks you your different questions. This is excellent. Again, when you have these opportunities to go through thinking through these questions, it really expands your knowledge on the topic, in my opinion. Otherwise, I wouldn't ask you to review them in every chapter. Okay. So we need to know the difference between religiosity and spirituality. We need to know the difference between congregational model and institutional model, right? We need to know that faith nursing brings in the spiritual. That's the big difference, brings in the spiritual connection into the healthcare. We need to know that faith nurses work very involved with maternal and infant health. Okay. And then the last chapter, let's cover real quick. You may be doing a lot of this part on your own, but that's fine. This chapter, I'm going to cover this for 10 more minutes. And then the last 5 minutes, we're going to do our attestation. Okay. So this chapter discusses home health and hospice together. Okay. We all know what a home health nurse does. We all know what a hospice nurse does. We're going to talk about each role a little bit more specifically in this chapter. Again, what's your chapter outline? Your PowerPoint, right? Here's what you need to be able to do after reviewing this chapter, right? Compare your different practice models, right? What's the different roles or responsibilities for home health and hospice? Okay. So this is a good read. This first section, right? It starts with home health. It's on page 525. Okay, this is an excellent summary of what is home health nursing? What are home health, what do you do?
They treat the person in their houses.
Right? What could you be focusing on? Are you focusing on maybe prevention, early detection, supporting after a diagnosis, right? You could be doing all hospice, you could be doing all of those, right? So home health care, not only home health does not refer to only home health. It's much broader than that, right? Even though care is provided in the homes, right? We know that the optimum location to provide care is in the homes, right? People want as much service as possible in their own homes, especially, you know, the new mothers, the frail elderly people, right? Hospice, chronic conditions, right? Home health has exploded over the last 10 years. Absolutely exploded. Right. And in home health, you know, even though the client may be our patient, we're dealing with the whole family. Right. So that's the other thing, is home health is expanded into family care right here, family caregiving. Right. We may be teaching family members how to give an injection, how to change a dressing. Right. So much of what was originally done in a hospital is now being done in the home care, in the home setting. So much of what's been done with hospice that was previously in the hospital is now in the home. Right? Levels of prevention applied to home care. This is excellent. Right? Primary, we administer vaccines. Right? Why are we administering vaccines? It's preventative. Right? Secondary, we monitor clients in their homes for early signs of new health problems. Right? So we're screening them. Home health visits, I've already said this, are the best opportunity to assess the entire scenario, the entire situation. Right? Guys, remember that discussion? You can assess everything for whatever reason you're in there. You can assess financial risks, food insecurity risks, environmental risk factors, safety risk factors, relationship, communication. How are people talking to each other? How are they acting? How are they treating each other? Or is the family supportive of your client? Home health visits are the best. Okay, so again, have a look at this primary, secondary, tertiary. The other thing that's great with home health is that nurses can practice much more autonomously than, say, in the hospital setting, right? Therefore, again, like rural and migrant, in the home health setting, you bring all your whole toolbox. You may be doing med surg skills, pediatric skills, wound care, maternal skills, mental health skills, right? So you got to be creative and competent in all these areas, right? So the home health environment certainly lacks many resources typically found in a hospital. So it's essential that you're organized, have good critical thinking, good communication skills, documentation, right? You're able to adapt. Maybe during the course of one day, you're doing a new parent, new baby home visit. And then by the end of the day, you're doing an elderly client, a frail elderly client that can't get to the doctor's offices, and you're doing medication, you know, helping them with their medication. So you go from one extreme to the other all day long. Okay. You can read through the history. I'm not sure why I have this highlighted. Oh, because we start with palliative care. Okay, so hospice care starts on page 526 right here. Okay, so what is hospice care? Care of the dying client and the significant other. Okay, what is hospice nursing? It's palliative care. Okay, palliative care is simply symptom management. I don't know, we all have probably been involved in this to some extent with a friend, family member, where somebody's gone into hospice. right? I don't know, some of you may actually have worked with hospice nurses to take care of a family member. They are the angels from hospice nurses. To me, they have a very special place in my heart. They work with the whole family. Obviously, they're working with symptom management for the actual client, but they're also working with the whole family. Care coordination, comprehensive support, wealth of knowledge for resources. They're able to pull in family members who may not want to be participating in this, maybe in the hospice process, maybe scared, maybe, I don't know, it's triggering something else. Hospice nurses are wonderful in working with the whole family unit. Okay. Your Cuen Box is focused on client-centered care. That's your competency we're talking about here. So there's practice models we need to know about. I just need you to know what these practice models are and what a quick description is of each. I think there's 5 of them. All right. So the first one is population home care, population focused home care. We're on page 526. Right. That's basically home health, home-based approaches to care delivery. We know produce better outcomes. So we're caring for populations in the home. Right. So population focused home care is directed towards the needs of specific groups of people, including those with high risk, such as mental health, you're picking a different population in your community, whether it's mental health group, cardiovascular group, diabetes group. It's population focused. Okay. Second is transitional care. Okay, it's exactly what it says it is. You're providing care from maybe somebody going from the hospital, from a rehab facility home, somebody going from assisted living to long-term care, hospital, discharge, home. That's transitional care. Okay, so we just need to know what these models are. Okay, so population, you're taking care of specific population. Transitional care, they're transitioning from one place to the other. Home-based primary care. This is your home care delivery. You're delivering primary care in the homes. Okay, these are people that otherwise can't get to the doctor's office. Okay, and then you may have a home health agency. Okay, and explains the difference in those. And the last is hospice. So there's your 5 practice models in home, health, and hospice. So I need you to know there are 5 practice models and a brief description of each. And I know I have a lot of this highlighted, but it's all good. If it's highlighted, I felt like it was really important. So this may be a whole section you want to read through. Your description of practice models, 526, goes through all 5 of them. Okay. 4. How many do we have? 4? Population 1, transition 2, home-based 3, home health 4, 5, and hospice 5. So I think isn't that one of our attestation questions?
Yes, ma'am.
Okay. And then of course we're talking about hospice now, is the home care of a dying child. I mean, again, I've had numerous students in my 20 years in school nursing that have gone home to hospice care. So I've got to know the hospice nurses dealing with the whole dying child. They may have siblings in the schools that are struggling. Parents are struggling. When you work with a family over years and years, and then all of a sudden we're faced with this, you become part of that hospice team as a school nurse, or I have. So again, nursing roles in home health. This is a good section too. Here's page 530. Here's all the things that we could potentially be doing, right? Or fulfilling the roles. We may be, depends where we are. If we're working in a rural community, we may be fulfilling every single one of these roles. If we're working as part of a team, or for an agency or a hospice group, we may be able to team up with others and we may be fulfilling some of these roles, but we have to be prepared to fill in all these roles. Okay. Okay. I highlight though, read through the Omaha, nothing need to memorize here, but know what the Omaha systems are. The Omaha system is, okay. It's a system we use to communicate with other nurses in the home health setting. Okay. So here's your description of it. It goes all the way back to the 70s. Okay. And it goes through a system, goes through the system of problem solving and how we communicated. Okay. So just have an idea of what the Omaha system is. Okay. To develop a structured and comprehensive system that could be both understood and used by members of various disciplines. So it's coordination of care. So the home health nurse knows what the hospice nurse is doing. The hospice nurse knows what the family's doing. It's just a coordination of care. Okay. To foster collaborative practice. That's exactly what the Omaha system was based on, collaborative practice. Okay. So I'm going to stop there. Just going through accountability and quality management. Evidence. This is where evidence-based quality and performance and client safety. I mean, we have to be focused on accountability and quality management in the home health setting and the hospice setting, right? This doesn't just go for hospitals, right? So what are some, I want you to know this, what are the quality improvement activities or what are a crucial part of nursing care delivery? Okay. Think of your ADPI here. Okay. So if you're asked about evidence-based quality and performance, what factors are in play here? Think of ADPI, monitoring care, seeing opportunities to improve care. That's evidence-based practice, developing guidelines to improve care, collecting data to improve care, making recommendations. This is all evidence-based practice in the home setting. Okay. And then here's your, as I told you, here's your legal, ethical, and financial aspects of home and hospice care. Okay. Financial as well. Legal, ethical, financial. Okay. So have a look at that. Here's your healthy people. Oops. Here's your healthy people 2020 box. National health objectives for the year 2020. All righty. I'm going to stop there because I promised 4 minutes ago. So if everybody pulls up their week 4 attestation, I would appreciate it. And what's your first question, Alex? What's your first question?
It was the differences in like
Oh yeah,
community. So it was,
institutional based and okay. So let's think back to our faith community.
Professor, we have a test that starts at 2 o'clock.
Okay.
Just to
All
let
right.
you know.
All right. So you know what? You guys go on and do the attestation. Okay.
But
All
yeah,
right,
then the other one was on page 526. It was those 5 of them.
Ooh, you guys, Alex just told you where to find it. 526. All right.
Jeez.
Thanks, you guys. Good luck on your test. Okay.
Thank you.
All right.
Thank you.
Talk to you later. Bye.